Hello everyone, my name is Meenu Sharma from Nursing Department, Clinical Instructor in RPIIT Medical and Technical Campus. Today my topic is pressure ulcers. Pressure ulcers, the other name as pressure ulcers, pressure sores, decubitus ulcer and bed sores. This is localized injury to the skin and other underlying tissue, usually over a body prominence as a result of prolonged unrelieved pressures. What is the risk factor of pressure ulcers? First one is friction, next is shear, third one is impaired sensory perception, next is impaired physical mobility, next is altered level of consciousness, next is fecal and urinary incontinence, next is malnutrition, dehydration, excessive body heat, advanced age, and chronic medical conditions like diabetes and cardiovascular diseases. What is the common sites of pressure ulcers? Elbow, inner knees, back of head and ears, shoulder, elbow, hips, low back and buttocks, inner ear, inner knees and heels. These are the common sites of pressure ulcers. Now, what is the stages of the bed sores? Stages system of pressure ulcers are based on the depth of tissue destroyed. Based on the depth, there are four stages of bed sores: stage number 1, stage number 2, stage number 3, and stage number 4. Now, what is the first stage? Non blinkable redness or intact skin, in which intact skin present with non-blankable erythema of a localized area, usually over a bony prominence. Next, discoloration of the skin, warmth, edema or pain may also be present. Stage 1 indicates at risk persons involve only the epidermal layer of the skin. Stage number 2, partial thickness, skin loss or blisters. A partial thickness loss of dermis present as a shallow open ulcers with a red pink wound bed without slug. Stage 2 is damage to the epidermis and the dermis. In this stage, the ulcer may be referred to as a blister or abrasions. Stage number 2, pressure ulcer, you can see the pictures. Now, stage number 3, full thickness skin like loss fat visibles. A stage number 3, ulcer is full thickness tissue loss, subcutaneous fat may be visible, but bone, tendon or muscle is not exposed. Epidermis, dermis and subcutaneous tissue is involved in stage 3. Subcutaneous layer has a relatively poor blood supply, so it's difficult to heal. Stage 4, full thickness and tissue loss. A stage 4 ulcer is the deepest, extending into the muscle, tendon or even bone. Full thickness tissue loss with exposed bone, tendon or muscle. Stage number 4, you can see the pictures, the stage number 4 ulcers. Now, what is the complications of bed sores or pressure ulcers? First one is cellulitis, second is bone and joint infections, third is sepsis, fourth is cancer. Now, what is the prevention of bed sores? First one is bed sores are easier to prevent than to treat. Although wounds can develop in the spite of the most scrupulous care, it's possible to prevent them in many cases. Next, position changes. Changing position frequently and consistently is crucial to preventing bed sores. Expert advise shifting position about every 15 minutes, that you are in a wheelchair, and at least once every 2 hours even during the night. If you spend most of your time in bed, Number 2, skin inspection. Daily skin inspection for pressure sores area are an integral part of prevention. Now, third one is nutrition. A healthy diet is important in preventing skin breakdown and in aiding wound healing, adequate hydration to maintain the skin integrity. Fourth one is lifestyle changes. Quitting smoking, exercise, daily exercise improves circulations. Four, five number is use pressure relieving devices such as air mattress and water mattress. Now, what is the treatment of pressure ulcers? Changing position often, carefully follow the schedule for turning and repositioning approximately every 15 minutes if in a wheelchair and at least once every 2 hours when in bed. If unable to change position on a family member or other caregiver must be able to help. Second is using sport surface. These are special cushions, pads, mattresses and beds that relieve pressure on an existing sore and help protect vulnerable area from further breakdown. Next treatment is cleaning. It's essential to keep wound clean to prevent infection. A stage 1 wound can be gently washed with water and mild soap, but open sore should be cleaned with a salt water saline solution each time the dressing is changed. Next is controlling incontinence. Next is fifth number, removal of damaged tissue. These can be say debridement. To heal properly, wound need to be free of damaged, dead or infected tissues. Sixth is dressing. Seven number is oral antibiotics. Eighth is healthy diet. Ninth is educating the caregiver. So thanks everyone.